Hi, I'm Dr. Diane Cleverly of Personal Healthcare Information, and thank you for joining us for this highlights of the American Society of Clinical Oncology 2014 annual meeting. One of the biggest studies that was presented at ASCO this year was ALTO, and that is one of the largest breast cancer trials ever conducted. This trial at 4 years showed that all of the arms had wonderful high 4-year disease-free and overall survival rates. The trial was expected to show a difference with a competitive advantage for combining the two drugs, but that was not shown. And this means that researchers have to go back to the drawing board and rethink adjuvant treatment for early breast cancer. Another study was presented by MD Anderson where they used a Watson-like computer to hand over the computer some case studies for patients, and the computer would actually spit out 80% of the time the correct standard of care treatment plan for the patient. It will be interesting to see. This is not the first one that's been showing up in the news lately, and it'll be interesting to see what the FDA does as far as regulating this type of program and whether or not it can be considered a medical device because it's recommending diagnosis and treatment. And the Institute of Medicine is reporting that gaps in cancer care are expanding, and that's not too unexpected. Financial toxicity is a side effect of cancer. Another really interesting thing they were presenting and speaking about was that 60% of all surviving cancer patients are over the age of 65, so they are in that baby boomer generation, and what that means for access and cancer treatment and cancer care education. One of the things, breast cancer was very prominent at ASCO. It was one of the biggest topics. There's always a smattering of all the other disease states. There wasn't nearly enough for pancreatic cancer and some of the other more rare malignancies, but breast cancer definitely was made a good showing at ASCO. And one of the really interesting kind of combination was that 2 studies showed that was around weight and premenopausal women, particularly those with ER-positive breast cancer. And they showed that hinted at weight loss may possibly protect from a rise in inflammation biomarkers. And we all know inflammation drives cancer, particularly breast cancer. And that it may also protect against mortality because higher mortality rates were seen when a woman was obese rather than normal weight in this other study. Thank you for watching. I encourage you to visit the ASCO site, www.asco.org, or to visit my website where you can find the individual links on the slides for each of the studies that I spoke about today. The website is below. You can just click on the link. It's http://personalhealthinfo.weebly.com, and I also encourage you to subscribe to my YouTube channel. Until the next video, take care. Remember, you deserve to be well treated and treated well.